Mr. Baldi, thank you very much for your time this afternoon. Now, you've issued a statement cautioning against hastily imposing travel restrictions linked to the Omicron variant. Now, this, we all know, will have serious implications for our economy. Why is it then that the international community confuses detection with origin? I mean, our competent epidemiology sector detected this, but many of us, in as much as we're not experts, would say this speaks of competency, but certainly doesn't say it originated here.
Yes, absolutely, and thank you for inviting me. And it's quite very remarkable, I mean, the way that this new variant has been detected and also reported, I mean, to the international, scientific and medical community. So this is something which we are really looking for all of the different countries. And definitely WHO really recommend not to have this travel restriction. That's not something that we are recommending at all, but definitely to adopt a kind of more risk-based approach. So really, to try to implement some of the other measures, like if something is happening in one country, and for the other countries really to enhance their surveillance at the main point of entry, to improve the testing and also to encourage the monitoring of the situation and the evolution of these different, events which are happening quite very quickly and very rapidly in different countries of the world.
But broadly speaking, COVID has been with us for more than a year now, albeit with different variants, of course. But how are we still reacting in this manner of harsh lockdowns in various countries and killing industries, even with that benefit of time? It's like every single time there's a new variant, we have just heard of the virus for the very first time. How are we responding like this?
Yeah, I do think it's also important to mention that each of these variants has its own characteristic. And the new one, which has been now just mentioned, there is a need to have more time to understand, really the behavior of this variant and of this virus. And from there, definitely to take some of the most appropriate measures, because all of the variants might be different. We saw when we just discovered, the Alpha, the Beta, the Delta in different areas of the world. The Alpha was discovered in the UK, the Beta in South Africa, and the Delta in India. And so we know that definitely there are some different actions which need to be undertaken. And what we are really advising the community, the people, the population is really to become calm and to stay calm and to really take the time to allow the community, the international scientific community, to understand better this situation and the consequences and the effect of this virus. The WHO has classified this variant as but it will take some time, some weeks, really to have all of the different impact of the variant on the severity of the disease that it might cause, but also all of the impact on the diagnostics, on the test, and also on the vaccination. So at the moment, definitely, we really need to have a kind of collective effort in a very solid manner, all of the different countries to tackle this situation, because we know that the viruses, they do not have any border. They don't know what is about a border between different countries. So they will move, across the different countries. And this is what we have seen over the past 2 years. So definitely, targeting only one country cannot help us to resolve this problem. But we really need to have this collective, exercise, collective efforts, to find the most appropriate solution, for addressing the consequences of this situation.
Perhaps speaking of the ability of this virus to move, will this approach of governments not see significant transmission all over the world? Because countries are focused now on bans and not necessarily engaging South Africa on its initial study to establish vaccine efficacy and the likes. All they're focused on right now is let's ban. But we could see the transmission.
Yes, the transmission, I think, again, we really need to take the appropriate time, really to understand the dynamic of the transmission of this new virus. But at the meantime, the effect that it has on the existing current, drugs and also testing, diagnostic methods, and at the meantime, also the therapeutics. So these elements need to be definitely, we really need to work on these ones, but this has to be done in a quite very open and solid manner. And these interactions, this is what WHO has been doing, for the past few days now. It's about convening the entire scientific community, to work together, to share the information, because we know that this might happen also in other countries, and therefore really to take the most appropriate measures. So I think really having this risk-based approach that we've been promoting, during the past, weeks, during the past months, in regard to the current situation, that's how I think we can really try to handle this situation at the moment.
Well, the horse has bolted. The US has now joined the EU in restricting flights from Southern Africa, albeit precautionary or a precautionary measure, as the US has said. But what can you do at this point to salvage the situation for South Africa and our economy?
I do think this work really need to continue again. Having some of these advocacy at different levels again, for trying to have a better understanding of the situation, but also to encourage really countries to be more open and to be more solid and to interact, to continue interacting. And obviously to think about all of the consequences, the direct social and economic consequences, but at the meantime also to discourage other countries, to share the information that they might have. So this another consequence on which we really need all to know, because if you are not aware about what is happening in different countries, if countries decided not to share the information, therefore I think the risk will be an invisible risk, and that threat is more important than the one that we are having now. This is a situation that we really need to handle at the global level, very globally, in a very solid manner, in a very collective manner, based on the most, evidence-based information that we have at the moment.
Should we expect as a country that there will be greater effort on the side of your body to engage some of these countries that have actually imposed these restrictions on South Africa to really talk about the conversation of origin and detection? Should we expect in the coming weeks more engagement from WHO with some of these countries?
Yes, these conversations, they are happening already, and they might continue definitely in the upcoming days, in the upcoming weeks. And we do expect that more evolution will come and also more understanding will come. And then also, to take the most appropriate action, as I was saying, implement some of these travel measures, based on the kind of, risk-based and scientific really approaches, and to be able, to implement more effectively and to have the impact that we really wish to have, and to protect everyone, all of the different countries, against this virus. And again, it's not definitely by closing different borders and making those major restrictions that we can get to that, but to have this openness and to have this dynamic where people can feel, comfortable, for sharing the information for the entire global, human community, because this is something which might affect all of the different countries at the same time.
Now, this announcement of a new variant also brings to the fore the conversation around vaccine equality, because we could see perhaps efficacy no longer being strong enough in terms of the current vaccines we have in the country. What are you doing, or what conversations are you having around vaccine equality?
This is not also a new conversation. For the past 1 year and 1.5 years since the discovery of this new vaccine, the World Health Organization has been working, tirelessly for really trying to have a kind of more equitable distribution of the vaccine, and this work will continue. And we are seeing, if we do not take all of the measures for limiting the transmission of the disease, or different new variants may continue to occur. So we really need to take all of the measures, for having a more equitable distribution of the vaccine, but also to continue encouraging different people, different communities on adopting the other public health and social measures, because we really need to reduce the transmission rate of this disease, and therefore to reduce the chances or the risk of having new variants as we are seeing currently.
No, certainly. Dr. Balda, thank you very much for your time this afternoon. That's Dr. Thurno Balda talking to us on the announcement of the new variant of COVID-19.